We're now joined by Dr. David Adinaro, Deputy Commissioner, Department of Health in the area of Public Health Services at New Jersey, and also the chair of the COVID-19 Vaccine Task Force. Doctor, great to have you with us.
Thanks. Happy to be here.
You got it. By the way, as you see our website, look at the interview we did with Commissioner Persicelli as well in Department of Health. We're taping on the 16th. This will be seen later. It's not a day-to-day report. Big picture, biggest challenges the Department of Health has faced to date as it relates to vaccine distribution?
So several things. I think, first of all, just getting up an entirely novel network of vaccinators to be able to handle both these vaccines that require, honestly, special storage in terms of the cold chain and ultra cold chain, making sure that our IT systems are able to handle the influx of information coming into them. And then obviously just the communication with the public about where the vaccine's available, the information about the particular vaccines, and then handling, of course, all the unexpected weather-related issues and everything else that comes along with getting the vaccine into New Jersey and then making sure people are able to access it safely on any given day.
Doctor, let me ask you this, as we are here on the 16th, say it's March 16th, April 16th, if the vaccine supply from the federal government is dramatically improved, how much will that dramatically improve the distribution and their shots in the arms?
Significantly. I mean, right now we are able to get every week all the vaccine made available to us, allocated to the vaccinators and essentially into people's arms. And all of our vaccine sites really are just crying for more vaccine. They've matured a lot over the last 2 months. And if the federal government is able to double our supply, we're going to be able to both increase what we're doing to our current vaccinators and bring on a whole lot more groups of individual vaccination sites that are currently not being used because we don't have the supply for them.
Doctor, it's obviously not just how many, but who they are, meaning who's getting the vaccine, who's not. In terms of the great disparity in the African American and Latino community, particularly in the Black community, the numbers are just way too low. What is specifically being done to address this serious problem?
So several things. I think first and foremost, we are beginning to have some targeted sites that are within communities of color, and we're excited about the fact that we're teaming up with some of the resources that are being provided by FEMA and also working closely with the communities, including ministers in that community, to tie those two together for the vaccines. And the other part is, I think, just increasing access. We're excited about the fact that CVS and Rite Aid now are getting vaccine directly from the federal government. And we know that we have a lot of sites that are in people's neighborhoods that we really want to increase the supply of vaccine to them in order to make it easier for all communities, but particularly the ones that have been the hardest hit, access the vaccine.
By the way, check out NJ Spotlight News every night for what is happening day to day in New Jersey. But a follow-up to this. So much confusion around scheduling, around the website, as we do this, again, the telephone, the hotline number, not enough staff there, hard to get through. So for someone who says, hey, why can't the Department of Health and the state, quote, get it together? Why isn't it easier and smoother? Ain't that easy?
Well, we certainly wish it would be easier and smoother. First of all, we're creating things.
But it's something to be expected. Listen, it's not my job to make excuses for the department, but it's not that easy.
No, these are actually very complicated things that we're putting together, and we're doing things that we've never been called upon to do before. Healthcare, unfortunately, in the United States has always been very fragmented, and so this is fragmented also. But I do think that we have a great set of vaccinators who really want to do the right thing and are trying as best as possible to cooperate and see if we can get a little bit more unity and make it a little bit easier for people to access.
In time we have left, vaccine resistance, beyond distribution, beyond supply resistance. Numbers any better, doctor?
Yeah, so the surveys we're looking at definitely show that people are more open to getting the vaccine. And I think there is hesitancy out there. I don't think it's so much resistance as people want more information and are a little bit hesitant. And we know that as we move past the people who are very excited about receiving the vaccine, that we're going to be, having to talk to people, honestly and giving them robust information that it will encourage them to consider the vaccine and be open to getting it. I also think that as more people get the vaccine, and they see that it's working and that there aren't a lot of side effects, I think that's going to make a lot of the people who are hesitant more comfortable with receiving it themselves.
Yeah, in the minute we have, how do you define herd immunity? What's the number?
So we don't know yet, right? We know that any number is better. Numbers that have floated around are 70 or 80%. I think it's important to understand that.
Of the adult community or everyone?
Well, that's the other part. Right now, we only have a vaccine that's available to adults or anybody over 16, and we don't know what the right number is. We do know that if you get vaccinated, it will protect you, and that we do think that you getting vaccinated will protect your loved ones around you. But right now, I think we're really focused on getting as many people as possible vaccinated because we know that's the safest way to end this and to end the risk for everybody.
But social distancing and masks not going away anytime soon?
No, I mean, I do agree with a lot of what people said that the fall of this year should look very different than what's going on now. We will have vaccinated a lot of people by summertime. But right now, if you've been vaccinated, you're still going to need to mask up, distance, quarantine if necessary, and follow all the other precautions that are out there.
By the way, we've had the Department of Health COVID website up, the CDC as well throughout this segment. Doctor, I want to thank you so much for joining us.
Thank you for having me.
I'm Steve Adubato. We thank you so much for joining us, and we'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, NJM Insurance Group, the Healthcare Foundation of New Jersey, Georgian Court University, PNC, Grow Up Great, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, and by St. Joseph's Health. Promotional support provided by NJ.com and by ROINJ.
Being a kid is all about playing, laughing, and having fun. Doing what they do best, from rolling in leaves to building a snowman. But when illness or injury slows your little one down, you want the best pediatric care possible. Turn to the experts at the St. Joseph's Children's Hospital to get your superhero feeling super again. St. Joseph's Health, helping kids be kids.